Hello everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today I wanted to share with you a file of the patient that we had before in 2023, and we will gonna talk about his 1-year result together. So let's check together the file and the case and the photos of the patient. So Lime is from Ireland, he's 29 years old, 2016 he had his hair loss problem started. And he used for 2 years finasteride and minoxidil. Then he stopped for a while, but his hair loss continued, so he applied to us. First, I always wanted to talk with the evaluation photos that the patient sent to us, because I want to show some differences, because we want a real good photos from the patients to really evaluate in the right way. So let's check his photos that he sent to us. So as you see, typical male pattern baldness, but in the frontal part, in the bald temporal part, he has some restoration need. But in the central part of the frontal part, he has very thinning and weak hairs, we can notice. Mid-scalp seems good and crown area seems good. So let's check what we take in the clinic. Let's start with his frontal part. You see the similar pattern of the temporal parts. Also, central part looks worse, and in the mid-scalp till the crown area there is a transition zone of hair loss problem. So it is way more worse than the photos that he sent to us. Okay, so we planned, as you see in the photos that I'm showing you right now, we try to take high hairline for this patient, because if we lower the line and if we have not so much grafting with the patient, at that time we could not cover in the enough density. That's the reason with this patient we planned the maximum grafting to be extracted from the donor area, and we really extracted 4,150 grafts in total. Our plan was to create the line, fill the both temporal parts, restore the frontal part, the mid-scalp, and whatever remaining we were going to use for the crown area. The crown area was too good as it looks like, but still sometimes because we are doing something in the other areas, if we have some graft remaining, we want to use for the crown area, because if he need in the future, we can't implant too many grafting on the crown area, and today implanting some grafts to that area will be more efficient for the patient. Okay, so after we did his planning, as you see, I want to show you a shaved photo of him as well, because in the shaved photo you can see also in the frontal part, in the frontal central part, there was some graft, some hairs there, but as you see it is not too much, and we need to implant too many grafts into that area to make it very strong actually. Let's check what we did as implantation. Okay, you see that we filled the both temporal part, we filled the frontal part, we did some transition to the mid-scalp, where he has already existing hairs. We increased the density between those hairs, and for upper crown we also did some incision too. Okay, so let's go by one. Okay, this is the 13 days photos. The 13-day photo is usually, patients always ask for us how it looked like after the operation. I think that's something to go inside the audience and walk around people, so people will be looking with the curious eyes to you. At that time, because remove the crust, we have a clean scalp in the recipient side. It looks very good, and it's, of course, there are some redness depending on the skin color of the patient. Sometimes if it's very dark, it looks like very less, but if it is very blonde, it is a little bit more reddish. But you can see that he has a good appearance in the frontal part. Only maybe the problem could be the donor area, because there's a difference of the contrast between the existing non-shaved and non-extracted area, implanted area, and the extracted area. So we advise patients at that time to do the shaving to make it equal, to seem better. But even though it looks normal for the patient actually. Okay, let's jump to the first month photos. First month photos is usually the patient will be still in the similar condition that he has the pre-transplantation. Sometimes the existing hairs could be also affected by the shock loss too. That's very normal, by the way, don't worry, but most of the transplant hairs will be gone into a shedding phase, and we don't see too much. Maybe some demarcation areas like the redness in some recipient site appearance. That is the maybe concern for the patient, but that's all. So third month. In the third month, we always expect 30% or 40% of the whole results. Sometimes it could be a little bit early, it could be sometimes a little bit late. But for this patient, as you see, it started to grow, especially in the temple parts where there was no hair. So patient even started to be happier in the same time. Still some redness because it is growing right now, but then it will be hidden and it will be recovered within time. 6-month photos. Wow, so he is in a good condition so far. As you see, he changed a lot as the appearance. His hairs start growing, plus it is very 70 to 80% maybe. Still not some weakness we can notice in right now. It will be better within months. His donor area looks very good. And overall, patient still in this month could be very happy, but we expect more. So let's see the other 12th month of final result. So a totally different man. He was a total different man before, and he's different right now. So he changed a lot. Of course, the beard appearance and other things also makes it different, but he's a new guy, so we are happy to see him like this. In the front, it looks good. Temple parts filled very nicely. Central part is very strong. The appearance from side looks very natural. You cannot notice that he had hair transplantation, which is the natural results with many patients. Donor area seems very okay, nothing at all. Crown area, maybe noticeable some lower density appearance, but still the mid-scalp and crown, mid-scalp and the frontal area was covered with 4,150 grafts. I think it's a successful operation and it's a successful ending for the patient. So I hope you enjoyed the case study with us, and if you have still questions, please write on the comments and we will be answering soon. Thanks so much.